Hi, my name is Bob Morrison. I'm 86 years old. I live here in Rolla. I had a heart attack. I was registered to walk in the public house Halloween 5K, and I made it past the first mile marker and flatlined on them. And however, I was walking with a nurse who knew how to administer the compressive CPR, and I passed the 1 mile marker, and the gentleman sitting there called the ambulance, and she had given me CPR, and the ambulance got there in about 5 minutes and got me resuscitated, and then they flighted me to Columbia. So at Columbia they did the heart catheterization and a triple bypass, and then I was there. The surgery was on November the 2nd, and I got out on November the 10th. The doctors, I've walked a lot. I walk about a mile a day for the last 10 or 15 years. And so my heart was very strong, so strong that when it couldn't get through the main artery, it was 99% blocked, it started sending out pulmonary veins to try to search for oxygen and blood. So it was very strong, but it's still so blockage, they had to go ahead and do the bypass. We were all shocked at the heart attack because I was in really good physical shape. I worked outside in my yard. I had 3 acres to take care of. I worked outside. I was in good physical shape. They didn't keep the arteries from getting blocked. The social worker came by and wanted to know word about getting care after I got out of the hospital. At that time, they were again talking about putting me in a residential care facility, and again, when the doctors looked at me and said, he doesn't need that, he needs something else, he needs a rehab program. So they said, go home and take the home health. People come out and did the rehab and did the physical therapy, but then after that, you're going to need something, and you had to follow through. And I knew about the program here, so I said, and they wanted me to come to Columbia. I said, no, there's a rehab program right in Rolla, so I'd like to go there. The women, the nurses there are phenomenal. Helen, Kate, and Kelly, they're phenomenal. And one of the things I learned is they did push myself. They're always going around saying, can you add 1 more minute? Can you add another stress level? They're always pushing a little bit, but to check on you all the time. Again, it's encouraging me to exercise probably more carefully. Walking is good, but I need to expand some of that to some other areas, and that's what they've been telling me to do, to expand the exercise. The first time you come in, they take your blood pressure, and then all the time you're working out, they've got the pads on you to monitor your heart rate, and they can check that periodically. If it's going too fast, they'll come over and tell you to slow down. But then they also take your blood pressure when you leave, and the place over there is phenomenal. They're very warm, very greeting. As soon as you come in the door, hi, good morning, and very caring people. I couldn't say enough about them.